Hey, creative ones. I'm about to go live here. It's Melissa D'Antoni. I'm about to bring on Dr. Tenesha Weine. If you're here, say hello. We're going to talk about from burnout to badass and how to recover, maintain, sustain, and evolve your energy systems in your body, in your emotional body, in your mind, your body mind. Yeah. Just gonna give a few minutes here. Let's see. Hi, Greenville. Hope I'm saying that right. Just waiting for Dr. Tanisha to join us live. Let me see if I can bring her on. I can tag her. Let's see. We are going to have a super juicy discussion about energy and how to reclaim, maintain, sustain, evolve your own energy systems. Hi, Kelly. What's up, my sister? Just waiting for Dr. Tenesha Weine to join us here in a moment. There she is. Bring her on. Hey. Happy almost Halloween. Let me set up my camera here. Okay, we are adding Tanisha, so just give it a moment and then we're going to dive in. Just wait for a few more people to join us. How's everyone feeling today? Almost Halloween. Getting a little spooky out there. So I see that it is adding Tanisha. Let's try again. Tanisha, we may have to do blue jeans after all if it's unable to add you. Let me see. Just give it a moment.
There we go.
There's my sister.
How are you?
I'm doing great. How are you?
I am doing well.
You look amazing.
Great to see you. Now you're thank you. Now you're still on Martha's Vineyard, right?
We are. Yes, we are.
Yeah. That's awesome.
So I want to do a quick introduction to everyone. Tanisha, by any chance, I just lost my headset. Do you have a headset nearby, any chance?
I do.
Do you mind putting yours on only because I think there's a little background noise coming through. Thank you so much. So while you're doing that, I want to introduce you and share a little bit about our journey over the years. So I first met Tanisha. Tanisha, I think did we meet at Rise in Austin? Rise, the entrepreneurial conference.
Here we go.
Okay. So I was doing quick interjection. And did we first meet at Rise, the entrepreneurial conference? Is that where we first met? Like 12 years ago?
No. And I have a testimonial on this. I was working with a therapist and she said, I need to go do something fun. And I found your painting class online. I came to your painting class.
Oh.
Yeah, from UT. And then we started going to, I think we went to eWomen, maybe.
Yes, you went to the yes. It's all coming back to me now. Yes. So you came to my class at the University of Texas in the art building there. Yeah, the informal class, one of my first classes outside the studio. That's great. The intuitive painting class.
I think you had just moved it to your home. Like, I think I missed that class, but called you. The first one I did was in your home studio.
Oh, yeah.
In the yellow house.
Yep. That was where I first opened my studio, in the dining room there. In 2007.
And then I think we started talking business and did some women in business networking after.
And some of the Rise stuff too. Hey, Alan.
Yes.
Awesome. So, Tanisha and I go way back, and I think what's really that's going to be unique about this interview and about why we're so passionate about energy and energy work and, is that we've both been clients of each other.
Yes, through the years. Hey, we got to keep each other upright.
Yeah, absolutely. And I think both of our modalities are really complementary in terms of energy work, and managing energy, and they're both multi-dimensional. So I think that's really cool, and one of the things that really excites me about this conversation. But I really just want to interview you about the energy recovery system that you have created and developed through your work. And let me actually introduce you and your background too. And you may have to jump in here, but Tanisha is a chiropractor, but you're not just a chiropractor. I mean, every time I tell people, like, I just went and saw my chiropractor, but she's not really a chiropractor. She's a chiropractor. She's an energy worker. She does acupuncture. She does, what is it? Emotional freedom technique. What is the
neuroemotional technique. Yep.
I mean, this woman has so many tools in her, bag of tricks that, as you can see from behind her, she works with herbs and
muscle testing
and how the energy flows through the body.
Yeah. Absolutely.
Yeah, wouldn't you say?
Absolutely. It's all energy based, right? All of it. And bringing us back to homeostasis is exactly that, working on your energy.
Yeah. And how it flows through all the energy systems in the body too, which I think is also unique, that you have. It's not just the physical body, it's the emotional body, it's the mental body, and from some of the work that we've done together, it's through all of those bodies, and seeing that is one multidimensional system, and the other thing that I think is really unique about you, and also about our journey, that I just wanted to share, we've talked about fertility over the years for women, and we have shared too about our own journeys into motherhood. And I remember when I got pregnant, you were like, you have to read the book Spirit Babies, even though I was, pregnant. And I just referred that book to a client last week. We were talking about it yesterday, which also made me think of you, and just what an incredible journey it has been to support each other and to, learn and grow together, as women, as mothers. And I just really want to thank you, for that.
Oh, thank you. Yeah. You've been an amazing support in my journey as well, with all the painting work I've done and the workshops and the full day intensives around everything, trauma release, all of it has brought me here for sure.
Yeah. Beautiful. Thank you. So tell us a little bit about what you have discovered over the years as a chiropractor, and what you've created in this new I mean, I think it's really kind of revolutionary, and I really want to tell people about it. will you tell us what brought you to creating the energy recovery system?
Yeah. So I've been in practice since 2006 in Austin, Texas. And I would say the majority of my practice is chronic pain, chronic fatigue, women that have had the diagnosis of fibromyalgia, absolutely hormone balancing, autoimmunity, thyroid, fertility. Sometimes we go into menopause too. And through the years, I found that there's so many things that we do with almost every patient to bring them back to balance, to take them from burnout back to living their life, because a lot of the health issues I've found go back to what's going on in their life. What traumas are they going through? What traumas are they processing? Are they in a job that is soul sucking that they hate? Are they in a relationship that's toxic? You know, a lot of these go back to what's going on in their life energetically. I can, every patient that knows, okay, you know, it was this month and this year that my symptoms came on, I would say, okay, what was happening the year and the month before? Let's talk about that. Oftentimes it so much comes back to one trauma, one event, and it could be anything, a divorce, a family, you know, parent passing. Sometimes it's a pregnancy. I absolutely think grad school is a trauma. We've both been there. So there's a lot of similar things that each patient responds to when bringing them back to balance and rebuilding their body, that I found myself doing and saying a lot of the same things over and over. And I also found myself being asked by people in our office, hey, I have a sister in Iowa. I have an aunt in California. Can you work with her? So we started doing more phone consults, some video consults. And I just one day was like, I want to put what I do into an online module program that can help anywhere in the world, anybody, anywhere in the world. And so that's what I did. But with it, I've added one-on-one health coaching as well, and functional medicine labs that a lot of people in different areas either don't have practitioners like that or don't have access to that. So it's been wonderful. I've been able to help more people in more places get their life back.
Great. That's beautiful. And who would you say is the ideal person, the ideal woman for this particular program? Because I do think when you're dealing with energy work and energy recovery, there needs to be a level of responsibility and empowerment, right? So who is this for? Who is this designed for? Who's really going to benefit from it?
I probably get the most success from women who have something to lose. Something's on the line, either their role as a mother, as a leader, as a business owner, and they know if they don't get their energy back and they don't balance the biochemistry in their body and get their anxiety under control and, you know, their life in order, that everything's going to come crashing down. And they know that. So really somebody who's motivated to make some changes, to look inside their body and to make the changes, or they're going to risk losing everything. And this is something I went through after having my daughter. My body completely, I was building out a new clinic. I had 2 new doctors I was onboarding, and my body was like, nope, no more, shut down. And I have a history of Lyme disease, and I thought it was that. And it wasn't. It was an autoimmune thyroid and Epstein-Barr virus. Like, I was just spinning all the plates, and my body said no more. And you wouldn't have known by looking at me or talking to me or coming in as a patient at all. None of my staff knew I was struggling with energy issues. None of my patients knew.
We know how to mask it very well, don't we? We have this, I think sometimes as leaders, and mothers, we just, that's the first thing to keep going until we have to change and make the decision to take care of ourselves.
And what I'm finding with this program is, because so much of it is done on your own, at your own pace through the modules, a lot of women that are in corporations, in corporate, that they don't want anybody knowing that they're seeing a natural functional medicine doctor, let alone they don't want anybody to know they're suffering from fatigue or burnout or anxiety or insomnia or whatever it's presenting as in their body. So doing something like this in the privacy of their own home has been so helpful for these people who just don't want to have to take a half a day off work to come see me.
Right.
or someone like me.
Right.
Yeah.
To do. So is there a group aspect where they have community and support with the other women that are also struggling with the same challenges?
Absolutely. Yep. We've got women from all over the country right now in the program, which is amazing. And we have group calls kind of like this where we're able to support and help each other. Someone that's in the second month versus someone just starting can help lift them up too as they're healing and again, just relate on our wins and where we're getting stuck and struggling and leaning in for help for that coaching accountability. But yeah, the community of women, again, most of them are women that have something on the line, businesses, jobs. One woman came to me and said, I'm going to lose my job if I don't get it together. Like the fatigue and anxiety is overtaking me.
Yeah, and I think I want to hear your approach to diagnosis like that, or to, to how do you hold, as an alternative to a traditional, medical approach, how do you hold, what is your approach to those diagnoses?
Well, first of all, I don't believe the body shuts down for no reason at all. There's got to be an underlying cause. So we start with, and included in the program is starting with an extensive functional blood chemistry lab. And that tells us, we look at things differently. So Western medicine kind of gives you a range from here to here, right? Like a big range of normal. We're looking at a much smaller, tighter range. So something might be a low normal or a high normal, and we're going to address that. People may go to the doctor and are told all the time. In fact, I've done multiple lectures on this. Why do I still feel so bad when my lab tests are normal?
Yes,
people are told all the time, oh no, your labs look good.
I had that with my thyroid over the years. Absolutely.
But it may be normal in just 1/10 of a point, and to you're having all the hypothyroid symptoms, and you're being dismissed because you're in that range. So that's one way we look at things a little differently.
Anyway.
Right. No, you're absolutely right. And then people go home and think that, okay, it's all in my head.
And then it kind of,
it's all in my head.
Perpetuates a lot of the systems because, not feeling heard, or not feeling validated, or not feeling seen for what you're experiencing, and then not being given the solutions. I think that's what's on the, what gets to the place where you have something on the line, because you have to change. You have to bring your power back to listening to your own body. I think that's a big part of it.
Absolutely. I would say there's tears with clients weekly of saying, oh my gosh, thank you for finding that. And I'm not crazy. And there is something off. I knew it. Like, you're in your body. And that's what I tell women all the time. You're the only one in your body. So you're the only one that knows when it doesn't feel right. And don't take no for an answer if you know it's a yes.
Absolutely. I did that
huge.
with when I had hypothyroidism in my 20s and all through my 30s, and I was on and off medication, and I finally was living in San Francisco and seeing the head of endocrinology at the UCSF, who was a wonderful man. And I had nodules, and he was basically like, you're going to be on medication for the rest of your life. And I was like, no, I'm not. I was really clear that I was not going to take a pill for the rest of my life. So I said, what are my options? And he said, I don't know anything about it, but go try acupuncture, go try energy medicine.
Oh, wow.
And that's ultimately how I got off my thyroid meds and ended up really taking adrenal support. It was really in my adrenals, which is what your program addresses. And once I had that supported, and I was painting regularly, expressing myself, finding my voice, living my purpose, because it was all throat chakra, life purpose, self-expression. Once I was living that, I naturally, was able to not need medication. And the thyroid is the first thing when you're pregnant too to be susceptible. And my thyroid levels were perfect my entire pregnancy. So I didn't have any struggle with that without any medication since I was in my 30s. That and getting off birth control.
That's amazing.
You know, it is so horrible. But yeah, but my point in sharing that is like, you can decide to take control of your health and trust yourself and find alternative practices and experiences. And it's not just one thing, right? When you say it's not just one thing, it's a collective of things that activate and awaken your own energetic body and get it flowing again.
So many things you said there. So many things ring true. First of all, it's never just one thing. And we're the only country in the world that separates mind from body. So absolutely your throat chakra had something to do with you not speaking your truth and your thyroid. Absolutely. And then second of all, amazing that he said, go try this. Like, a lot of doctors laugh at people.
Yeah.
Like, sad and make or shame them. People have gone in and say, hey, I'm trying this natural thing, and they're like, oh, you shouldn't do that, you know, what are you thinking? Horrible. But the adrenals, absolutely. The thyroid just doesn't wake up one day and say, I'm just going to slow down. I'm just going to go way, I'm going to take your metabolism and bring it way down. You know, there's a reason. And oftentimes it is the adrenal glands overworking. And the adrenals and thyroid are really, you know, they're antagonistic of each other. If one goes up, the other goes down. So if you're under high stress, which I know you were in grad school out there, your adrenals were in fight or flight, and your thyroid goes, whoa, sister, you need to come down. And now we have hypothyroidism, because you can't live in this fight or flight for weeks, months, years. You're going to keel over. So the body's doing exactly what it's supposed to do. And you hear about CEOs, right?
Yes.
And CFOs having heart attacks.
Yes.
I think a lot of that's
Absolutely.
adrenals pumping the heart
Yes.
too much. And so your body was doing exactly what it was supposed to do. It was trying to calm.
Exactly. I mean, the body just knows, right? To how to equilibrate itself. But this is another segue into, you know, and my grandmother had hypothyroid. I saw my paternal grandmother, be on Synthroid for her entire life, and then struggle with depression in her elder years. You know what I mean? And so that was a generational pattern, and it's collective in women.
Yeah.
I mean, I coach women and have been coaching women for years. And one of the first things I ask is, how's your thyroid? You know, how is this wound, this generational collective wound, the woman's wound, right? How is this manifesting in your physical body? You know, this energetic block in your throat around finding your voice, around living your passion, around living your purpose, around expressing yourself.
I love it.
You know?
Absolutely. Absolutely. Now we're getting into the field a little bit of epigenetics.
We love to talk about.
We love it. And we're both working so hard to change our genetic imprint for our daughters. So hard. But that's another part of the program. We dig in and do deeper testing that you just won't get traditional medical route. And we do some genetic testing to see, is this, like you said, an energetic pass down, right? Or is this, you know, genetic? And I do believe the energetic can change your actual genes. Why are there so many gene defects? It's because
and
what's
when
going
you
on.
say too, from the work that you've done with me and the initiation and the journey of the worthy, wealthy, wild woman, that this, you know, doing this work energetically and working through creative self-expression energetically can change, right? That epigenetic, like, we can change through a lot of different ways now, you know, those patterns, those imprints, and they are trauma based. They're rooted in trauma that has been passed down, and without, you know, judgment and blame, but with a level of personal responsibility and clarity and compassion. Like, it's time to reconcile these patterns and evolve them, not just for our families, but for the world.
Absolutely. Absolutely. We have to. And which is why spreading this message, what you do, what I do, is so important. Fix it now. Stop the patterns with that. Stop the illnesses.
Right. Yeah. Break the cycles. Beautiful.
Absolutely.
So tell me how your program supports that more specifically.
Yeah, so we dig into, the first part is digging into where the imbalances are in the body. And we do address past traumas, what's keeping your adrenal gland stressed now, all before we even get into the hormone balancing. The first month essentially is building you up, dealing with some of the endocrine imbalances, some blood sugar issues, dealing with past traumas, stressors now. Then we'd go into some gut repair because 80% of the immune system's in the gut. There's a lot of autoimmunity that starts in the gut, a lot of brain chemicals, and I know you know a lot of this. Serotonin, dopamine, those are all made mostly in your gut lining. People think it's in your brain. We now know there's more serotonin and dopamine made in your gut. So people that are, you know, on the traditional American diet, or they call it the standard American diet, SAD as an acronym, the standard American diet, are having, are having a lot of anxiety and depression because of the foods they're intaking are inflaming their gut lining and they can't make their brain chemicals. So we start doing some gut healing to get your brain clear. And then we go into a liver and infection detox, which 90% of the time when there's fatigue, anxiety, chronic pain, inflammation, find an underlying infection, either bacterial, viral, or fungus.
Or I remember I did a lot when I did some earlier work with you, work around parasites. And parasites, you know, I had just done all this testing and I'd worked with several different practitioners and doctors. And I mean, I took the herbs, I took the drugs, you know, everything, and could not. And I finally was tested as gluten sensitive. But I ultimately came to you and I was like, Tanisha, and you had just come back from Haiti. Do you remember that? You had just come back from Haiti.
I do.
Doing Chiropractics Without Borders, right?
Yeah, mission work. Yep, Cairo mission is what it was called.
After the earthquake there, and you had yourself had a parasite, right?
Yes, I remember that. But I tell people you don't have to have been to a third world country to get a parasite. They're everywhere. You could pick them up at salad bars. You could touch a grocery cart, put it in your mouth, and pick up something. But yes, I remember that.
Yeah, and well, I had traveled all through Southeast Asia before graduate school, so I knew I had put in Laos and, you know, in the rivers there, and I knew I'd picked something up. And, you know, you gave me, it was just a tiny little vial, remember? Of medicinal turpentine. And that was like the thing that did it.
Yep.
You know?
Yep. Still use that. Absolutely. Still a go-to. And sometimes, you know, these infections, I think possibly in your case, they can lay dormant. Yes. I mean, they can lie dormant for
10 years.
Years. And if your immune system takes a dip because you're under stress, you're in a job or a relationship that's stressful, or you get another sickness, you get the cold, you get the flu, whatever, right? Your immune system does this, and these guys are like, woohoo, opportunistic time. She's weak. Let's come out. And so, you know, they could have been in there for a long, long time and then came out. Yep.
Right.
Which is hard sometimes to trace.
Right. We did all this testing and we couldn't figure it out, but I still had the symptoms. It goes back to that. Like my body was like, something's not right, you know?
Mm-hmm. Yes. Listening to that part of your body. So in
your program, how do you address these imbalances? You do it with diet, you do it with herbs, you do it with testing.
Yep. All of that. Diet, lifestyle change, herbs, mindset change. A lot of times we have to take it back to as simple as, do you believe you can heal? Do you believe you're worthy of feeling good? It sometimes is that simple, but that complicated.
And it's a choice. Yeah. And you know, to take responsibility for our health and to nourish that mindset, if you will, you know, because we've had so many programs, so much programming and conditioning around, you know, I think this is part of the women's wound too, because I've seen it, and it's not just women, you know, but for the purpose of this, I'm gonna, you know, but you know, how is being sick serving you? How are you getting your needs met because of an illness? Are there better ways to get your needs met? Right?
A lot of people identify with being the sick person in the family, or absolutely, or their mother was sick, so they're adopting, well, I'm going to be sick as a mom, or, you know, whatever the case may be. You're absolutely right that sometimes it's hard to get out of that thought process, that pattern. You know, you have to reprogram the brain, and that's where a lot of your work is amazing, because if you don't start with your mindset and the brain, we can do all the right level
Yeah,
balancing
take the
in
right
your
herbs and
body.
eat the right food, but if you're not, yes.
Will you go back to that in 6 months, 2 years, 3 years? You know, maybe if you're resonating with that and you're not doing the work on both, again, mind body connection. We're the only country in the world where there's a different doctor for
And the
both.
energetics too. And I think that's why it's so essential to do the trauma work, because if you don't clear the trauma impact, right, in our DNA, in the genetics, in that energetic imprint, that the grooves are so deep and they are so mirrored in our society, right, and in our culture, that unless we really get to the root of the issue, the energetics, the emotion, usually it
Yeah,
has an emotional component far often than not. So
absolutely.
until we get down to that, we're just treating the symptoms and we're not in full recovery.
Absolutely. And that's the goal. We want to recover from it, no longer resonate, no longer, you know, align with that even energy of chronic fatigue, fibromyalgia, autoimmunity, whatever it is. You no longer identify with it is the
Right.
goal.
You evolve
Mm-hmm.
those patterns essentially, right? If you're just looking at energy.
Absolutely.
So what are some of the results of the people that have taken your program? What does that look like, and how long does it take somebody to get to that place if they're really committed and they do the work?
Yeah. Oh man, where to start? So I have a woman in the program now that simple things. She said, I'm able to come home from work and keep my house clean and not need a nap. That's been huge. And the energy recovery program is 12 weeks. So just 3 months we're making these huge changes. One woman hadn't danced at a wedding, hadn't danced in 2 decades. She danced at a wedding. Like that seems
Yeah.
so little, but she was like, you know what? I got up and I danced and I said, I'm going to pay for this for 2 days. And I didn't. Like that is huge. That is just such simple things. The same woman was also able to travel recently. And she said, normally airport travel's, a little tiring for everybody. But she said she would get to her destination and have to recover for 2 days and not even be able to enjoy a vacation. She's like, I wouldn't get out of bed for 2 days wherever I was going. And she was able to get up and go the next morning.
That's amazing. That's awesome.
Yeah. So just simple
and how
life,
long is
getting
your
back to life, getting back to your
yeah,
business.
how long is your program?
12 weeks, just the energy recovery program is 3 months. Now we do have ongoing support if your case is a little more complicated. Like we've dug down into some genetics, or we've dug down into we also test brain chemistry through urine, so we can look at brain levels. We test hormones, estrogen, progesterone, testosterone, and saliva. So sometimes there's layers, but for the most part, I'd say 90% of the people really recover in, again, if they do the work and lean in, 90 days.
90 days.
3 weeks. I'm sorry, 3 months.
Yeah, 3 months. That's beautiful. So
Yeah.
if people want to sign up and if they're a good fit for this program, they're committed, they're ready to take responsibility for their own energy flow, especially as it relates to the physical body, and channeling more energy and feeling more vibrant, how do they get in touch with you?
I think the best thing would be to follow the link
Yes.
that you're going to post, the energyrecoverycall.com link, and just get on the phone with me and see if you're a fit. I don't work with everybody. Like they have to be, like you said, ready, committed to do the work. And you're so graciously, anybody who joins this program, you're going to do a session with them. Yeah. So tell us about that. So first of all, get on the phone and let's see if you're a fit, because again, they've got to be ready. They got to make a change. They want to change their life. But then, yes, if they sign up, if through this video and listening and following you, you're going to do an extra bonus session with them.
If you enroll in a call with Tanisha, if this is speaking to you, click on the link and I'm going to give you a private session on using creative alchemy to alchemize your emotional and energy flow and teach you through the use of art how you can metabolize your own energy. If trauma comes up, if you get triggered, you know, how to clear that, how to release it, how to start evolving and rewiring your own emotional energetic system through all the dimensions. That means the mental body, so your mindset, your thoughts, right? Because when we have trauma, we get stuck, right? It's like a glitch in the system. And we anchor in depending on how we respond to the experience at the soul level. With a limited belief gets formed, right? And then it creates an emotional pattern, right? And that affects how energy how life force runs through our system. And sometimes we inherit those programs until we choose to consciously evolve them. And so this tool that I'm going to teach you is a proprietary, ancient, alchemical, creative tool, which Tanisha has used in her own process.
Oh, yeah.
So she knows the benefits of self-expression to really alchemize and evolve your own energy flow so that you can free yourself up of limitations and have more energy, more creativity, more joy, more access to your own wisdom and, you know, love, really.
It's priceless. Learning to do this is priceless.
It's really a lifestyle.
Yeah, learning
it's a daily practice. So we're going to go in and give you a little bit more support about what could be at the root of if there's any core trauma that is at the root of your energetic imbalance. And I'm going to work with Tanisha and with you to support you and giving you the tools that you can and the practices that you can use ongoing. So that you get that. This is just for people that sign up this week?
Yeah. Yep. In the next 7 days for the get on my schedule, because I only take calls Wednesdays and Fridays for the energy recovery system. I've got a pretty full practice. So just 2 days a week. So we'll extend it for 7 days. And now, and so, if they get on a phone call, enroll in the energy recovery system, they get that session with you. Now you have a program as well that I've offered to get on the phone for an hour with someone and go through what their next steps might be, what labs they may need, what their next steps are. Yeah. Biochemistry wise. What is your program that you're doing?
This is for women. It's called The Initiation. It's the journey of the worthy, wealthy, wild woman. And I offer it.
I've done that one.
This, you know, this is the epigenetic work.
Powerful.
This is the, you know, ancient alchemical work of claiming your power back from these patterns, from these generational wounds. We clear the karmic patterns on the family line, on the financial line, on the feminine line. So the woman's wound, you know, I created this from my own journey, but also from working with so many women that know that, you know, stay almost like in hiding or denial because of all this blocked energy, right? In these belief systems and paradigms that keep them from their soul's calling, from living their purpose, from using their gifts in the world, from fully expressing themselves. And so if this is you, if you know you're meant to do something bigger, if you know that you feel stuck or that your energy's out of balance, you know, one of these programs or both could really support you in taking your life to the next level. And Dr. Tanisha and I are and to working together. And what I love about these two programs together and working together on this is that we're tackling disease, we're tackling trauma, we're addressing it at an energetic level, right? And through all the body systems. So you are going to get the support, feel better. You're going to feel an immediate shift. Oh, I think we lost Tanisha there. You're going to feel an immediate shift. Let's see. See if I can bring her back on. And I'm going to post the link. See if we can get her back on. Okay, so if you would like to do the energy recovery system and go from burnout to badass, and that means really like claiming your power back, claiming your energy, claiming your well-being. You know, I just wrote a post about this. Our wealth is in our well-being. The root word of wealth, true wealth, is in wellness, right? The root of wealth is wellness. So this is about claiming your wealth. This is about committing, honoring your willingness to create that that wellness, that wealth for yourself. Okay, I am going to post this here. Tanisha, I keep trying to bring you back on. And it's not letting me. All right, so I just post. It's saying it can't bring you on. Okay, so we'll just complete. I'm going to add the link to the energy recovery system and to join Tanisha. She says she's here. I keep trying to add you, Tanisha, and it's saying it can't bring you on camera. So we'll just complete for now. But thank you so much. This was such a juicy discussion. I'm sure it was the first of many more conversations about energy management, taking responsibility for your energy. And if you would like to do the or apply for the energy recovery system with Tanisha and also receive a hour session with me to get to the root of what is the traumatic imprint, the energetic, the karmic imprint, the emotional charge around your symptoms so that you can shift it really quickly. And the other cool thing about this is that you are not tied to this diagnosis. Whatever diagnosis you have, or even your symptoms, like you can change them and relatively quickly, like within 3 months or less, right? So, the other thing I wanted to mention, if you want to do the journey of the worthy, wealthy, wild woman with me, the initiation, this is really the deeper work. This is for leaders. This is for women leaders who are ready to unlock their power and claim their sovereignty in the areas of family, of just being a woman on the feminine line, clearing the feminine line and clearing the financial line so that they can really claim, so that you can really live your life in full self-expression, with grace and ease and fun. So Dr. Tenesha Weine has also offered a hour session to work with her and talk about what labs you might need, how certain symptoms are showing up in your body, different herbs, diet, things that you can do to support this shift in your physical body, this energetic shift in your physical body, and especially if you're dealing with a long-term illness or health challenges. I think the most exciting thing is that it doesn't take years to resolve this stuff. It just takes you showing up fully for yourself. So sending so much love. I'm going to put the links to both programs below, and I'm sending you so much love. Bye for now.